Picture a 68-year-old man standing in his garden on a warm Tuesday afternoon. He reaches down to pick up a watering can, and suddenly, a wave of lightheadedness hits him. His balance falters for a brief moment. He shakes his head, grips the nearby fence, and waits for the spinning to stop. He tells himself it is just the summer heat, or perhaps he stood up too quickly. He goes inside, sits in his favorite chair, and pours a tall glass of water. By the evening, the dizziness has passed, but the hidden pressure inside his vessels remains dangerously high. The quiet damage continues completely unnoticed. 1 in every 3 older adults takes daily medication to manage blood pressure. It is one of the most common medical routines in the entire world. Yet, a staggering 70% of seniors taking these pills are completely unaware of how they actually alter daily body functions. The part nobody tells you clearly enough is this: these medications are powerful tools, but they change more than just a number on a cuff. By the time you finish this video, you will know the 9 critical hidden truths about amlodipine, losartan, and lisinopril that your body wishes you knew today. Most people believe that once your blood pressure reading drops into the normal range on a doctor's machine, your cardiovascular health is perfectly protected and your job is completely done. That belief is costing people their lives. The medical literature on this topic is unambiguous, and it says something very different. A normal reading is merely a surface signal, not a guarantee that your blood vessels are thriving. Let me explain the deeper truth. Numbers lie. True health requires deeper understanding. Subscribe to Fauci Health Insights right now and tap the like button. It takes 4 seconds and it matters more than you think. We are working toward 50,000 subscribers, and we are building this channel on a single, unwavering principle. The medical system makes money when you stay sick. It does not make money when you get better. What I am about to tell you today, your doctor will not say at your next appointment. There is simply no time for it in a 12-minute visit. And frankly, there is no financial incentive for them to explain it either. So let me show you what is actually happening inside your body, because once you understand the mechanism, you will never dismiss these signals again. To truly understand how your blood pressure pills work, we must first look at the vast network of vessels inside you. Think of this system as a complex network of flexible garden hoses supplying water to a vast, delicate lawn. Your heart is the main pump, sending vital fluid through thousands of miles of these pipes every single minute. The vessels need to remain soft, flexible, and completely unobstructed to keep your brain, kidneys, and muscles alive. In a perfectly healthy body, the inside of these hoses is lined with an ultra-smooth layer called the endothelium. Think of the endothelium as a flawless non-stick coating inside every single blood vessel. This non-stick surface allows blood to glide effortlessly without friction, keeping pressure low and stable. The vessel walls naturally expand and contract based on how much blood your organs require. High blood pressure occurs when these hoses become stiff, narrow, or clogged with debris. When the walls harden, the heart must pump with incredible violent force just to push blood through the rigid pipes. This high force constantly scrapes and tears at that delicate non-stick coating. Over time, the smooth surface becomes rough, scarred, and heavily damaged. The terrifying part of this process is that your body hides the damage for decades. Blood vessels do not have pain receptors on the inside. You cannot feel the non-stick coating stripping away. You cannot feel the pressure stretching your vessel walls to their absolute limit. People feel completely fine until a vessel suddenly leaks or blocks entirely. This brings us to the ultimate tipping point. When a stiffened vessel finally gives way or clogs completely, blood flow to a major organ stops instantly. If that happens in the brain, it is a stroke. If it happens in the heart, it is a heart attack. The damage shifts from completely invisible to entirely catastrophic in a matter of seconds. Sign 1, the evening ankle swelling. Picture yourself sitting down to watch the evening news after a long day of moving around the house. You pull off your socks and notice deep red indents press firmly into your skin. Your ankles look puffy, heavy, and unusually thick. You press your thumb against your shin, and the dimple stays there for several seconds. This specific fluid buildup happens because of how amlodipine alters the mechanical valves in your lower body. Amlodipine works by forcing the tiny microscopic gates in your blood vessels to stay wide open, which lowers pressure globally. However, gravity constantly pulls blood down into your feet and legs while you stand. Because the vessel gates are forced open, blood pools heavily in your lower extremities, and fluid leaks out into the surrounding flesh. Most people look at their puffy ankles and assume they simply spent too much time on their feet. They think it is just a normal consequence of getting older. That excuse is dangerous. Ignoring this swelling allows fluid to chronically stretch the skin and damage the delicate veins in your lower legs. Over months, this neglected fluid pooling can lead to painful skin ulcers and permanent tissue scarring. Doctors call this condition peripheral edema, and when a patient describes it, we immediately look to adjust the medication dosage. The body is telling us the dose is too high. Listen to your feet. But that is only the first piece of the puzzle. The second sign is even easier to dismiss, and it can disrupt your sleep completely. Sign 2, the chronic phantom tickle. You are lying in bed trying to fall asleep, and a persistent, dry tickle forms in the back of your throat. You sit up, drink a sip of water, and try to clear it, but nothing comes up. It is a completely dry, hacking cough that returns every time you lay your head back down on the pillow. This frustrating cough is a direct side effect of Lisinopril, an ACE inhibitor that blocks a specific chemical pathway to relax your blood vessels. When this pathway is blocked, a natural inflammatory chemical called bradykinin builds up heavily inside your lung tissue. Bradykinin irritates the hypersensitive nerve endings in your airways, tricking your brain into thinking something is physically stuck in your throat. Many seniors assume this nightly annoyance is just seasonal allergies or a mild cold that refuses to clear up. They buy over-the-counter cough syrups and lozenges to soothe the irritation. This approach fails completely. A bradykinin cough will never respond to standard cough medicine because there is no actual phlegm or viral infection to treat. Continually coughing puts immense, unnecessary pressure on your chest and can actually cause microscopic tears in your throat lining. The clinical name for this is an ACE inhibitor-induced cough, and medical professionals know it will not stop until the medication is switched. We take this very seriously because chronic sleep loss weakens your immune system. The third sign relates directly to your daily energy, and it mimics natural aging perfectly. Sign 3, the midday balance shift. You stand up quickly from the dinner table to answer the front door, and your surroundings suddenly tilt. You have to place a hand firmly on the wall to stabilize your body as your vision dims slightly. Within 10 seconds, your head clears, and you walk to the door feeling completely fine again. This brief spell occurs because all 3 medications can slow down your body's natural pressure-adjusting reflexes. When you sit, blood pools naturally in your torso and legs. When you stand suddenly, gravity pulls that blood downward, away from your brain. Normally, your vessels instantly squeeze tight to shoot blood upward, but the medication keeps them relaxed, delaying the reflex. Seniors almost always blame this quick spell on simple fatigue or a lack of deep sleep the night before. They shrug it off as a typical sign of turning 70. This assumption is highly hazardous. The danger here is not the blood pressure itself, but the immediate physical environment around you. A single second of profound dizziness can cause a devastating fall onto a hard tile floor or down a flight of stairs. We classify this temporary drop as orthostatic hypotension, and doctors treat it as an urgent warning to modify how a patient moves. A fall can change your independence forever. The next hidden effect alters how your body handles a vital mineral every single day. Sign 4, the unexplained muscle twitches. You are sitting quietly reading a book, and the muscle just above your knee begins to twitch rapidly on its own. Later that night, a sudden agonizing cramp locks up your calf muscle, forcing you to jump out of bed in pain. This painful cramping often traces back to how Losartan interacts with your kidneys. Losartan blocks a hormone that tells your body to hold on to sodium and excrete potassium. As a result, your kidneys begin retaining high amounts of potassium while flushing out fluid. When potassium levels rise too high in the bloodstream, it disrupts the electrical signals going to your muscles. causing involuntary spasms. Most people assume these cramps mean they simply need to stretch more or that they didn't drink enough water during the day. They treat it as a minor nuisance. Allowing potassium to climb unchecked does far more than cramp your legs. Potassium controls the electrical rhythm of your heart muscle. If levels climb too high, it can cause dangerous irregular heart palpitations that can stop the heart entirely. Clinically, this imbalance is known as hyperkalemia, and it requires a rapid blood test to evaluate kidney safety. Your muscles are broadcasting a chemical warning. Never ignore a persistent cramp. The fifth sign affects your mouth and can permanently destroy your dental health if ignored. Sign 5. The changing gum line. You are brushing your teeth in front of the bathroom mirror, and you notice your gums look unusually thick and puffy. They seem to be growing upward, covering parts of your teeth that used to be completely visible. When you floss, the tissue bleeds easily, even though you clean them every day. This tissue overgrowth is a well-documented side effect of long-term amlodipine use. The medication alters how the calcium channels inside your gum tissues regulate cell growth. This alteration causes the collagen matrix inside your gums to overproduce cells, leading to thick, swollen, and overgrown tissue. Seniors typically assume this swelling is just standard gum disease or a sign that they are brushing too hard. They switch to a softer toothbrush and hope the puffiness goes away on its own. Left unchecked, this excess tissue creates deep, hidden pockets around the roots of your teeth. Food particles and dangerous bacteria trap inside these pockets, leading to deep bone infections and eventual tooth loss. The medical term for this swelling is gingival hyperplasia, and dentists and doctors must coordinate closely to manage it. Your oral health directly impacts your heart health. Now, let us transition to a critical sign that changes how your brain receives oxygen. Sign 6. The waking mental fog. You wake up at 7 in the morning, but your mind feels incredibly heavy, slow, and clouded. You struggle to remember where you placed your glasses, and completing your morning crossword puzzle feels unusually difficult. It takes 3 hours and 2 cups of coffee just to feel fully awake. This morning fog happens when blood pressure drops too low during the middle of the night. Your medication works 24 hours a day, and your blood pressure naturally dips while you sleep. If the medication is too strong, your pressure drops into a valley, drastically reducing the flow of oxygen-rich blood to your brain cells during the night. Seniors almost always dismiss this morning sluggishness as an inevitable part of brain aging or poor sleep quality. They accept it as their new normal. Consistently starving your brain cells of adequate oxygen during the night accelerates cognitive decline. It weakens your memory pathways and leaves your brain vulnerable to microstrokes that destroy tissue silently. Medical professionals call this nocturnal hypotension, and we fix it by changing the timing of your medication. Your brain needs consistent, steady pressure to thrive. Let me now share a specific story of a patient who experienced these signs firsthand. I will call her Dorothy, 71 years old. She was the kind of woman who had raised 4 children, managed a busy suburban household for 40 years, and had never once in her life gone to the doctor without being dragged there by her family. She was fiercely independent and proud of her active daily routine. Dorothy had been taking Lisinopril for 3 years and noticed a slow, creeping fatigue and a mild evening cough. She assumed her constant tiredness was simply the natural consequence of taking care of her grandchildren. She began drinking energy drinks and taking over-the-counter allergy pills to suppress the nightly throat tickle. During a routine checkup, she finally mentioned that her morning walks had become so exhausting she had to stop and sit on the curb. She looked at me very quietly and said, "I thought that was just what getting older felt like." That exact sentence has stayed with me for 15 years of practice. When we ran her lab work, we discovered her blood pressure was dropping dangerously low during the night, and her kidneys were struggling to process the medication load. Her body was exhausted from a lack of consistent daytime circulation. We immediately adjusted her medication timing and lowered her dosage by half. Within 2 weeks, her energy returned, her nightly cough vanished completely, and she was walking 2 miles every morning without a single pause. She left that final appointment a completely different person, not because of a new prescription, but because we finally explained the mechanism. Let me now show you what is actually happening underneath all of these signs. It is happening in the majority of people watching this video right now, and almost none of them know it. The real root cause of blood pressure issues is almost never a lack of medication. The upstream driver is the loss of cellular elasticity throughout your entire vascular network. Your vessels are losing their ability to produce a vital gas called nitric oxide, which naturally tells the vessel walls to relax and widen. This root cause goes undetected for decades because your body compensates by making the heart pump harder to maintain circulation. You feel absolutely nothing while your vessel walls are slowly thickening and stiffening under the strain. Return to our metaphor of the garden hose. If you leave a rubber hose out in the freezing cold and baking sun for years, the rubber becomes brittle, stiff, and prone to cracking under pressure. Your vessels do the exact same thing when exposed to chronic inflammation and poor lifestyle factors. The moment this hidden damage becomes a visible crisis is when a stiff, brittle vessel in your brain or heart finally ruptures or blocks completely under a sudden spike of stress. By that point, the damage is done, and prevention is no longer an option. Now I want to tell you about the everyday things you are probably doing right now that are making this vascular stiffening process much faster. Some of them will genuinely surprise you. The first item is eating packaged deli meats and canned soups regularly. Most people consider these convenient options completely harmless because they are low in fat. However, these foods are packed with hidden sodium and chemical preservatives that instantly cause your body to retain fluid, inflating the pressure inside your vessel hoses like an overfilled balloon. The second habit is drinking large amounts of grapefruit juice in the morning. Grapefruit contains unique compounds that completely block the specific liver enzymes needed to break down amlodipine. This causes the medication to build up to toxic levels in your bloodstream, drastically multiplying your risk of severe ankle swelling and dangerous dizziness. The third factor is taking over-the-counter pain relievers like ibuprofen for joint stiffness. These medications constrict the blood vessels leading directly into your kidneys, impairing their ability to filter fluid. This directly counteracts your blood pressure pills, forcing your heart to work twice as hard. Now let me show you what actually works and why it works at a physical level your body can feel within days. I call this the vascular renewal protocol. It is a simple, zero-cost routine designed to naturally support your vessel elasticity alongside your doctor's care. Morning, the vascular wake-up. Within the first 10 minutes of waking, stand up straight, place your hands on your hips, and take 5 deep, slow breaths through your nose, holding each breath for 4 seconds before exhaling. This specific breathing pattern stimulates the vagus nerve, which naturally dilates your blood vessels and prevents that sudden morning pressure spike. The most common mistake is rushing this process or doing it while sitting down, which minimizes the expansion of your lungs and blood vessels. Daytime, the hydration bridge. At exactly 2 in the afternoon, drink 500 milliliters of pure water. That is 2 standard glasses over the course of 10 minutes. This specific volume expands your blood volume naturally, preventing the common mid-afternoon circulation slump and reducing the strain on your kidneys. Many people make the mistake of drinking coffee instead, which actually dehydrates the vessels and elevates pressure. Evening, the gravity release. Before getting into bed, lie flat on your back on your carpet or mattress and prop your feet up on 2 thick pillows for exactly 8 minutes. This physical position uses gravity to naturally drain the pooled fluid out of your ankles and back into your central circulation, reducing lower body swelling before you sleep. Do not do this if you have severe congestive heart failure without consulting your specialist first. Practicing this complete protocol consistently for 3 weeks produces a noticeable increase in daily energy and a reduction in lower body fluid accumulation. Now, here is something I want you to think about very carefully. Your age changes everything about how quickly vascular damage develops in your body. The same elevated blood pressure does twice the structural damage at age 65 than it does at age 35 because older vessels have less natural collagen reserves. Research shows that in people over 55, a high reading carries a 60% higher risk of causing an immediate circulatory event. How old are you right now? Write your age in the comments below. I am not asking out of curiosity. I want to know which specific age group I am speaking to most because it shapes every single video I make next for this community. Here's exactly what to do after this video ends. 1. Check your ankles right now. Press your thumb against the bone for 5 seconds and see if a visible dimple remains in your skin. 2. Look at your current medication bottle. Identify whether you are taking Amlodipine, Losartan, or Lisinopril, and write down the exact milligram dosage. 3. Drink 2 full glasses of water. This immediate hydration lowers blood viscosity, making it easier for your heart to pump right now. 4. Set a phone alarm for 2 in the afternoon tomorrow. Use this as your permanent daily trigger to complete your daytime hydration bridge. 5. Schedule a 5-minute conversation with your pharmacist. Ask them directly if any of your other daily supplements or over-the-counter pills are interacting with your blood pressure medication. 6. Request a specific kidney function blood test at your next medical appointment. This evaluation ensures your medication is not placing undue stress on your filtration system. Start with step 1. Do it today. The rest will follow naturally. Everything I have shared today is for education and understanding. Your situation is specific to you. Use this as the starting point for a real conversation with your own doctor, not as a replacement for one. I am Dr. Raymond Holt, and I have spent 15 years in clinical practice watching seniors struggle with the confusing side effects of standard cardiovascular medications. I made this video because I am tired of seeing patients suffer from preventable complications simply because nobody took the time to explain how their pills work. The traditional medical system is structurally flawed. Doctors are pushed by administrators to see 40 patients a day, leaving less than 10 minutes per appointment. The system is heavily optimized for rapid prescription writing rather than patient comprehension. This structural gap leaves millions of older adults completely in the dark about their own internal biochemistry. This channel exists because that specific medical math is completely unacceptable to me. Subscribe to Fauci Health Insights right now to help us reach our goal of 50,000 subscribers and join a community dedicated to true health literacy. One video at a time, one person at a time. That is how we change the system. If this reached you at the right moment, send it to one person who needs to hear it. You may never know what that one share does for them.